Welcome back. You're watching Business Today. And now we go on for the discussion on the stock market. Sustainable health and well-being of a population is a prerequisite of the overall economic and health social development of a nation. As many other countries, Sri Lanka is also experiencing the epidemiological transition. Healthcare services has a pivotal role to play in regard to this. Today's discussion is on key health trends and performance of healthcare industry. For an in-depth discussion, we have invited Product Head of Frontier Research, Mr. Travis Gomez. Travis currently manages Frontier News Curation products and is involved in developing Frontier's remote team of news curators and analysts. Welcome to Business Today, Mr. Travis.
Thank you.
Sri Lanka is privileged with widespread free health facilities and free education. And there are several key health trends in reference to Sri Lankan aspect. If we begin with fertility, elaborate on the current status of fertility in the Sri Lanka context.
Yes, so if you look at when it comes to health trends, I mean, usually what we expect is when a country goes through what we call a demographic transition. So that is when typically what happens is when the health standards improve, when people's living standards improve, what happens is as the nutrition levels go up, what we usually observe is that the fertility rates start to come down. And that has been the trend that we've seen in Sri Lanka since the 1960s till about the late 90s. We saw this fertility rate continuously coming down. And actually by 1998, it actually came down below what is called the replacement level. So that is essentially the level, if it's below that, that means that the replacement population is going to be less. Okay, but something strange that started to happen was the fertility rate actually started to pick up since then. And if you look at the most recent from census data, the 2011-12 one, it's come up to 2.4, which is above even countries in the region like Bangladesh. So there's a couple of, looking at this trend, this is kind of a bit strange situation. And if you look at some of the factors that might contribute to that, one thing that we've observed is that actually the age at which people are getting married has been coming down. So in the 90s, it was, if you take for females, it was around 26, 28 years. It has like come down to about 23, 24 in the more recent data. At the same time, a larger number of the population is also getting married, or the number who is staying unmarried is actually coming down. So that has been one factor. Apart from that, there are a number of other factors as well that contribute to it. So it could be even these things like particularly when there's some sort of like natural disaster, or given the conflict that we're having, that post-conflict, what tends to happen is that people become more optimistic about the future, and as a result they might be more willing to have children. So it's a bit early to say whether this trend is going to continue, because this has a significant impact in terms of our population. Because as per the previous forecasts that they had about population, they were expecting by 2040 to have about, I think the numbers were that you'd have like 22 to 23, 24 million population. But now with these new fertility numbers, there might be an additional 1 to 4 million people by that same time. So these changes in the fertility can have a significant impact.
Right. And WHO states that NCD, that is non-communicable diseases, are estimated to account for 25% of the total deaths in Sri Lanka. Brief us on what non-communicable diseases are and the prevalent status in Sri Lanka at the moment.
So the non-communicable diseases, I mean, the popular ones would be like anything related to cardiovascular or like cancer, blood pressure. Those are the typical ones that we would see. And usually this is something that normally happens when, as the countries, as income levels go up, as the aging population goes up, this naturally tends to increase. But the challenge is, unlike when it comes to communicable diseases or things like malaria or things like that, which you can immunize people against and which you can cure through that, fighting NCDs is much more difficult, because that requires like a lifestyle change. So really, more than actually trying to cure it, what you need to, the focus is very much on prevention. So that is this concept of wellness. And so that's really an opportunity for a lot of the private hospitals to capitalize on, because maybe the government hospitals may not be as geared to focus on that wellness aspect. So because of that, a lot of the private hospitals, this will be an opportunity. So to take a recent example, Navaloka, they actually have opened this thing called what they call Premier Wellness Center. So a lot of focus is like on nutrition, on exercise, and having these specific programs for that. So that is really an area that we need more investment on, given that our population is aging as well. So that's an area to focus on for the companies.
And regarding the aging population, which are the aspects to be considered, and how well is Sri Lanka prepared to take up this challenge and caring for the aging population?
Yeah, so at the same time, when you would see like fertility rates coming down, you also at the same time tend to see aging population, because as life expectancy improve. And in Sri Lanka case, that has been the situation. So right now, the stats are like there's about 2 million people above the age of 65. So that's about 10% of the population. And the projections are we are seeing very strong, high growth rates compared to the region in terms of the growth in that aging population. So the projections right now are by 2040, about 1/4 of the population will be over 65. So with that, there's a lot of opportunities as well as challenges. So, I mean, if you take like at an economic perspective, this has major challenges in terms of like things like pensions and things like public healthcare expenditure. But also there's a lot of opportunities, because this means there's like higher demand for like these things like geriatric care and having like basically assisted living sort of things. So because of that, there's a lot of scope for investment that can go into this area as well.
And regarding the female participation in the labor force, when we consider the relationship between health conditions, fertility, and female participation in the labor force, what is the reality in the local context, in the status that is reflected?
Yeah, so when it comes to, so there's a strong connection between the demographic factors and labor force, particularly the labor force participation. So usually what we expect is that as a country develops, as the fertility rates come down, as the child mortality rates come down, what we expect usually is that the female participation in the labor force should increase. Okay? But in Sri Lanka's case, it has improved. But what we've seen is that for the past couple of years, it's kind of just stagnated. It's basically been below 50% for a long time. And if you look at it, if you look at some of the reasons for it, there are a couple of broadly two reasons. So one is in terms of there are like cultural and like social factors. So those are, it's not something that is unique to Sri Lanka. In a lot of countries that go through this transition, it's only at the very late stage that you see actually these cultures and these societies shifting, where more people will start to, more women will start to enter the labor force. Another factor is also due to a lack of support in terms of having like daycare centers and like facilities to actually to accommodate women who have children to make it easier for them to transition back into work. So that's another area really for policymakers to look at, because that has been somewhat neglected. And at the same time, a lot of the private firms also, it's something they should look at more seriously in terms of facilitating this, because definitely it's something that you cannot ignore. Because what happens is, when in this demographic transition, as the population ages, what's going to happen is that there's going to be a bigger amount of people who are dependent on people who are working. So what happens is the working age population is shrinking. So on the one hand, what you want is you want more people, the people who are working currently, you want them to improve their skills. At the same time, in order to boost, to get more economic activity, you want the people who are not working to start working more. So that's, I mean, the ready solution there is the female participation. So that's definitely something you need to focus on a lot.
Right. With all that, we covered most of the key factors that was influencing and the current situation of the health sector. And we thank you, Mr. Travis Gilmas, for coming here to the studio.